Hello, everyone, and welcome to Israel Healthcare Highlights, where we share important information about Israeli healthcare with English-speaking audiences around the world. My special guest today is Dr. Sharon Merkin from the Gertner Institute. Hi, Sharon.
Hi, how are you?
Good, good. So we're going to be here about a really important study you've done about resilience in the wake of the war. And but before that, please tell everybody a bit about your background and about yourself.
Sure. So thank you for having me. Um, I am an epidemiologist, a researcher. I was trained in the United States in Johns Hopkins School of Public Health. And soon after my training, I did a master's there and then a PhD. I moved back to Los Angeles, where I'm from, and I spent the next approximately 20 years conducting research at UCLA at the School of Medicine there. About 4 years ago, I relocated to Israel with my family, and I started a position as a senior researcher at the Gertner Institute, which is part of Sheba Medical Center. There, I continued essentially my area of research, which is in looking at the social determinants of health, and transition to using Israeli data and doing kind of more local-based research.
Terrific, terrific. So please tell us about the study about resilience in the wake of the war.
Sure, sure. So part of what I had said, the social determinants of health, is social factors that affect our health, and that includes all sorts of factors related to how we live, how we work, where we live, and external events that occur to us. And one of the things I was researching before the war is how engagement, civic engagement, which means how we interact with the society in which we live, how do we try to improve the society in which we live, how that affects health. And so when the war started, we actually thought of doing this in relation to what was going on. And if you'd like, I can share some slides about that.
Please.
Um, so so you see this okay, right?
Yes.
Okay, I'm going to do it into a slideshow. So what we were interested in doing is specifically, this is me and a colleague at Gertner. We were interested, first of all, in looking how the trauma that people were exposed to during the war, so different types of trauma and different war-related kind of stressors affected health, and more specifically, measures of worsening physical health, mental health, sleep specifically, and starting negative health behaviors. And how civic engagement, so civic engagement, like I said, is doing any activities that really promote society. Specifically here, we're looking at volunteering. So as you see in this picture here, and a lot of Israelis can relate to this, there was a lot of civilian activity with regard to volunteering, primarily at the start of the war, but even ongoing today. And we wanted to see if that kind of activity somehow softens this effect of trauma and health. And so to do this, we took a sample of the general Israeli population. That was very important for us, a sample that would represent as many different types of people as possible in terms of citizens of Israel. And this was done about 6 months after the start of the war. We had over 1,100 participants, and they were equally sampled across age groups and across different regions in Israel. And we asked them about specific types of trauma that they experienced during the war. And just a couple things I wanted to kind of highlight, a couple results. One is with regard to volunteering patterns. So first of all, we kind of felt and we knew, and a lot of people kind of said, "Ooh, a lot of people are volunteering." But when you actually look at the numbers, they were really remarkable. So while some early reports said up to 50% of the population was volunteering, we actually found it was closer to 60%, over 60%. And this is a list of different types of volunteering activities we had our participants report about and that they reported doing. And as you can see, the blue bars are those who reported doing this for the first time, and the orange bars are those who also said that they did similar activities in the past. And one thing to point out is that these volunteering patterns, so the numbers, the percentage of volunteering really didn't differ across age group, across sex, and across income levels, which was really remarkable. And while it did differ across religious, ethnic group, and I want to point out here that we kind of had an underrepresentation of minority groups in Israel, but despite that, we did have about 10% of our sample were minority groups. It did differ somewhat, but the numbers were still relatively high. So the yellow bar is the Druze population. We had an enormously high percentage of volunteering, close to 80%. And the non-Jewish population, which is Muslim, Christian, and other, mostly Muslim, over 40% volunteered. So just so you realize, around the 30 percentage points is already considered high. So it was really high levels of volunteering. And with regard to our main question, right, does volunteering somehow blunt or protect the effects of trauma? We found that this was most remarkable and significant among those displaced. So displacement is a type of trauma that actually affects people globally and in a lot of different war conditions. Affected over 200,000 Israelis in this war. And in our sample, those who were displaced reported 39% reported worsening mental health, whereas those not displaced, it was 33%. But when we looked at volunteering levels among those displaced, we saw that those who were displaced and volunteered, it was slightly lower, 37% reported worsening mental health, while those that were displaced and did not volunteer, it was closer to 50% that reported worsening mental health. And so what these results really highlight and what they show, and I'm going to turn off the sharing for a second. What they show is that, while we try to obviously help individuals who are exposed to trauma, the idea here was that perhaps a social intervention, a community-based intervention such as volunteering, we have hints and suggestion from our data so far that this may be an effective way to kind of deal with trauma at the community level. And so we have a lot more things that we're looking at. This is just preliminary findings. And we're looking at kind of long-term effects of volunteering in different populations, as well as resilience protective factors to prevent PTSD and other negative consequences.
Well, that was really interesting. That was great. Before we wrap up, can you tell us anything about doing research in Israel compared to doing research in the United States?
Sure. So actually transitioning here was very interesting from a professional perspective, because the healthcare system is very different here. So there's a universal healthcare coverage, which for me, it was interesting because, as I said, I'm looking at social determinants of health and health disparities, and healthcare access across the board is meant to kind of neutralize that factor that's a big driving factor in health disparities in the United States. So one of the things that was interesting to me to see if there are remaining health disparities in Israel, and there are. And it's just an interesting kind of difference. And of course, population groups are different. And the data here are really extensive because of this kind of centralized healthcare coverage and centralized systems in a much smaller country. So from all those perspectives, it was very interesting and exciting to transition to health data. And of course, I maintain my collaborations in the US and internationally.
Great. So thank you so much for joining us, Sharon.
My pleasure. Thank you.